Winther with the American Cancer Society of Vermont, and I'm joined today by a very special guest from Northwestern Medical Center to tell you how NMC supports the ACS mission.
I'm Jamie Pinkham, and I am the Manager of Regulatory Affairs at NMC, which supports our Commission on Cancer accreditation as an organization. And I am also a past captain of the NMC team, and for 3 years served on the event leadership for the Franklin County Relay team.
I'm Sarah Sterling, Human Resource Advisor at Northwestern Medical Center, and I am the team captain this year.
Thank you.
I'm Chesea Mulheron. I'm the breast care nurse navigator. I work out of diagnostic imaging and support patients through breast health.
I'm Kristen Tuttle. I'm the RN care manager for oncology patients at Northwestern Medical Center. I have this really great job where I'm just available to people with cancer in Franklin and Grand Isle County to make sure everybody's getting their needs met.
Thank you all for joining. One thing we wanted to talk about today is how businesses and organizations are involved with the American Cancer Society, whether that's through Relay for Life or through year-round support and services. So I was wondering if one of you or each of you or all of you could tell the audience who's listening what are some resources available to them if they're either themselves someone who's going through cancer treatment, if they're someone who's about to embark on a cancer journey, or they're a caregiver or family member, or even, I guess, if they're a concerned citizen. What are some resources available through NMC?
You want me to start?
Yeah, Kristen.
So I have an office full of resources for patients and lots of different things. It takes a little bit of assessment to figure out exactly what people need, and then I can match that need with what's available in the community. We have everything available from a women's cancer support group called the Healing Circle that meets at the hospital the first Tuesday of every month. There are organizations in the community that provide sailboat rides and fly fishing trips for women and those kinds of things. There's also financial grants that are available, and we can help. I can help folks apply for those. There's emotional support things. There's lots of educational materials, physical things, and sometimes it's just facilitating conversations between patients and families. So helping everybody get all of the information they need to make the decisions they need. So sort of this huge toolbox full of stuff that's available, and then we really tailor what we're giving to people based on what their needs are.
Nice.
We're lucky. We have lots of resources for people here.
And for anyone who's looking for resources, whether they be physical or online, or if they just want to talk to somebody, you can absolutely talk to members of staff at NMC. You can also access resources at cancer.org. From there, you can view information online. You can also access information that can be printed and mailed to you if you'd like it in the comfort of your home or to share with someone in your community. There's also a live chat feature and our 1-800 number. That number is 1-800-227-2345. And as far as other resources available at NMC and what services you can receive, Chesea, do you want to tell us a little bit about how you and Kristen work together at NMC?
So Kristen and I were quite the dynamic duo. I kind of start with patients from screening to diagnosis and diagnostic imaging. We do tests to eventually just find cancer. I mean, that's the #1 reason why we do mammograms, is for detection of breast cancer. We also have a great lung screening program, which helps with our lung cancer patients, and we do great thyroid biopsies for thyroid cancer. So those are just a couple of the tools that we use in the hospital. So once a patient's diagnosed with cancer, Kristen and I, we kind of get together and meet these patients, whether they need to be met in the oncology office or even in the surgical suite prior to their surgery. So it's a great handoff from where I have worked with them through diagnosing them and supporting them in that aspect to now they're going to start taking care of their cancer. And that's where Kristen comes in with her great resources for that journey.
Great, thank you. One thing that we do unfortunately hear is that cancer is not something people are always comfortable talking about. We understand that it can be a very scary topic, it can be an uncertain topic, and through sometimes community events like Relay for Life or team fundraisers, people are able to do things that are fun, whether it's a car wash or a bake sale or dressing up in a costume, and it's an opportunity for us to also convey to survivors that you don't have to be scared. You know, we can have fun and support you and can spend time together. And those are some of the examples of activities that people can expect to see at the Relay for Life. Leading up to the event, though, some businesses like NMC as a team will do things. Sarah, do you want to share something that you guys did?
Yeah, I want to say the last 4 or 5 years we've been doing a bake sale, and we do it in conjunction with Hospital Week, actually. So we have a series of events where we're recognizing our staff and thanking them for obviously their service for the hospital. But at the same time, it's an opportunity for our staff to give back to the community. So we have this bake sale, and this year we did a bake sale, and we do, oh God, what do I want to call them?
A basket.
Basket and luminaries, and we raised over $1,000. So yeah, it's
our baskets which we bring to Relay. We started doing that probably 3 years in, and really we just pick up some momentum and hype around those baskets. So we sell the raffle tickets right at the same time as we're doing the bake sale, and usually there's some marriage with that in Hospital Week, so that we can say, if you buy this many raffle tickets, you get like a key. One year we did to the treasure chest, or you get entered this many more times into the grand prize. I mean, there's just the whole hospital gets behind this
and the outpouring
notion
of people who bring in baked goods. This year was like a record. We had so many baked goods, and just so thankful for everybody, and you know, the part that they want to play in being able to participate.
That's great, yeah. And for anybody out there listening, the Relay for Life this year is on Saturday, June 22nd. It's at Collins Purley Sports Complex in St. Albans. It's from 12 p.m. to 12 a.m. Don't let a 12-hour event scare you away, though. We would love everybody to be there all 12 hours if you're able to join us. But if you're not able to join us, that's A-okay. We will have a schedule online, so if you're able to come at certain parts of the day, you know when you might want to target that time. As Jamie was mentioning, we do have a great basket raffle tent where there's amazing prizes and items from all over the community that are available, and that is open from 12 to 8. For anybody looking for more information about Relay for Life and wants to know about the schedule and when things are going on, you can visit our website, which is relayforlife.org/FranklinVT, or you can call the 1-800 number, 1-800-227-2345, press number 2 for events, and specify Relay for Life of Franklin County, Vermont, because there are Franklin counties in other states. We'd love to have you there. And I'm trying to think, at the events, Jamie, if you've been there and other people have been there in the past, do you have favorite moments or memories of what it's like being there?
So being an event leadership for the last couple of years, I would get there at, before for setup at 6 o'clock in the morning, and we'd be there till 2 in the morning for cleanup. And the whole day is just packed with different little tidbits of things. My all-time favorite, though, is the luminaria ceremony. I think it's dark. There's a certain ambiance that settles over the track. The ceremony that goes with it is so mesmerizing and meaningful if you've lost somebody to cancer or have a survivor who is currently battling the disease. So it really is, if there's one thing that you can come to and really get the whole magnitude of the event, it's that hour between 9 and 10 after the sun has gone down and the bags are lit, where you really get the sense of what cancer has done for a community our size, because we're not that big. Franklin County is not that big of a community, but when you see that many bags around the track and in the bleachers, you recognize how impactful it can be on any community.
Yeah. And you can't forget the opening ceremony and the survivor lap. Survivors and their caregivers. That is really moving. You can tell at the beginning of the event there's a lot of energy, like people are ready to get going, and there's just this sort of like humble moment that comes over the crowd when you start to see all the survivors go out on the track and their caregivers, and they sort of lead the first couple of laps and everybody follows them, and it's just very moving. But it's a great event. I love it. I've done it, and the first time Jamie sort of twisted my arm, I had no idea what I was getting into, and I ended up showing up and staying like till wee hours of the morning when I had no intentions of. I thought I was going to show up and do a couple of laps, and just had no idea like how energized and mesmerized I would feel, participating in that event. I love it. Love it.
In the last few months, I've actually, in having conversations with people about Relay for Life, they've shared that they've gone through a cancer journey that they might have actually been very private about, and whether they receive treatment locally or farther away. I've heard from some people that an opportunity for them to actually feel solidarity in their community, to feel supported, whether they are verbal about their cancer journey or not, they can feel that at Relay. And so I guess one question I can throw out to any of you is, if someone came to Relay for Life and they were a cancer survivor or caregiver, and they really felt moved and connected, but they were looking for more information about, how can I be a better caregiver to someone, or if I'm going through a journey, what are different questions I should prepare to ask myself about resources? Do any of you have advice for them?
I definitely think there's a couple of different organizations in the state of Vermont that are always looking for volunteers that want to be helpful in supporting cancer patients. And it doesn't even have to be your direct loved one. There's a need for lots of things. I think people find people through their church sometimes, or through their kids' school, or sometimes that happens sort of organically by itself. But if it doesn't, they could always reach out to me, 524-8479, and give me a call, and I could get them plugged in. I could do a little assessment of what kinds of things they'd be willing to offer and get them plugged in, or give them some ideas about places that might be able to, because there is so much need. And there's so much different need. I mean, cancer isn't just diagnosed in people that are older anymore. Cancer is diagnosed in people that are young. And so being able to plug in a 30-year-old mom with another 30-year-old mom to talk about it is huge. And there are some organizations like the Vermont Cancer Support Network that manage a program called Kindred Connections, and that's what they're doing, is plugging in like diagnosis or like age, or matching those needs together. And they're always looking for volunteers.
Yeah, you bring up a good point, age. And one thing that we're trying to do with Relay for Life this year, by having a theme of Dr. Seuss, which was actually voted on by students at St. Albans Education Center, is just to have those conversations potentially at an earlier age. The American Cancer Study also has a program called Schools vs. Cancer, where we're trying to provide resources to teachers and educators, just to make sure that children feel as informed as they can be. I recently actually met with some 5th graders and was surprised when the teacher in the room asked for a show of hands, who do they know that has cancer? And I was shocked at how many kids raised their hand, because I think I wasn't able to raise my hand until my mom was first diagnosed when I was in high school. And so I guess, just out of curiosity, if there are families out there or youth, do you have any recommendations outside of coming to events, like how they can feel informed, or what NMC has available through other through NMC programs?
I know I recently met with the folks from Mahana Magic to see if there was more we could be doing for kids in the community here. And when we did a little bit of assessment out in the community about what children that are being affected by cancer need, a lot of things are happening through the school level and through the schools already. There's programs, and Chesea and I are involved in some programs. I think other people at the hospital are too. We're normalizing conversations about body functions and about what's happening, and trying to get younger people comfortable talking about things, so that when you do have to go to your doctor and say you've had a change in your bowel movements, you can actually have that conversation, and it's not so scary and it's not so weird. And we're starting to try to make those changes with younger people, so that that's going to grow, and build through time. So I think a lot of the support happens through schools. Our pediatric departments are also great and have counseling available in the pediatric offices too. There's care managers and both nurses and social workers in all of the primary care offices now in Franklin and Grand Isle County. So if they ever had questions about those kinds of things, they could work with the people in their specialist's office and also in their primary care office to get those kinds of resources and get plugged into the right places.
As an organization, we have a huge focus on the preventative side of this. So through the work that our Rise Vermont, which is a statewide initiative, but one that was started here in Franklin County in partnership with NMC. They're out in all of the Franklin County schools now, really getting kids engaged in fitness and wellness and stopping smoking. And the Maple Run School District just did a huge presentation on vaping and juuling and how that is another avenue that as parents we need to be in tune to, because maybe it won't be cigarettes, but maybe it will be that, which is, can certainly lead down a cancer path. So Relay for Life is just another opportunity for our organization to not only support the work that Kristen and Chesea are doing, of course, but also get our staff out and moving, and it's a fun event, and it's, you're walking and you're getting in your steps, and we have little step competitions, and our goal as a team has always been to keep one person on the track at all times for the entire 12 hours, so that we're doing both things there, and we encourage everybody to bring their families and their kids. We lost my father-in-law a few years ago from cancer, and my daughter has been irrecoverably changed by that. She's 11, and she's committed to starting her own team in the coming years. So, I think as a community, we've really shifted that culture, and Relay is just a great example of how it marries prevention and knowledge in the same space.
Yeah. And you bring up a good point about prevention. I think it seems that in the past, the American Cancer Society has been thought of as a resource in maybe a reactive way, that, once someone has a diagnosis outside of the resources that your departments offer, that if someone wanted things, they would come to us. But we're really trying to change that and be on the more proactive side. Our slogan is attack cancer from every angle. And I think a big part of that is connecting with youth and providing resources. So if there are businesses out there, schools out there, groups out there, please connect to local resources like Northwestern Medical Center and the American Cancer Society. We have printable flyers, info sheets, education that can be shared with children, with their parents, and those are available that you can easily print online and take home with you. And so we want to make sure that these resources are available for community members 24/7. If at any point you have questions and you want to call someone outside of receiving information online, I do want to say that resources, if it's a non-medical emergency, are available at cancer.org. Again, it's 24/7, or you can call our 1-800 number, which is 1-800-227-2345. I want to thank you ladies for joining me today. Is there anything else for anybody who might be listening that you might want to share?
No, I don't think so. Come to Relay. It's a great fun event, and hopefully we've got great fun weather. But even if we don't, we still manage to have a great time. So
yeah, absolutely. All right. Look forward to seeing you all on Saturday, June 22nd at the Relay for Life of Franklin County at Collins Purley Sports Complex from 12 p.m. to 12 a.m. We do encourage people to register in advance online as we do our best to be a good steward of our mission. We also want to be a good steward of the environment, so help us go paperless. If you can please register online ahead of the event, you can do that at relayforlife.org/FranklinVT, or by calling the 1-800 number, press 2 for events. Look forward to seeing you soon.